Yesterday, a viewer named Roxy asked a question on our Facebook page. She wanted to know if we knew how many people had recovered from coronavirus. Well, we sent her this. You probably can't read it on your TV, and that's because it's getting tough to fit all on one page, as you can see. These are the statements the state sends us when we ask for recovery data. And we've actually been trying to get you those answers since March. Those tiny pieces of text all the way at the bottom, that's the state copy-pasting the same exact statement they sent in April and again in June. Both times, Florida said it was, quote, developing new efforts daily. And we wanted to know what was taking so long. 10 Tampa Bay's Angelina Salcido spoke to a doctor who shed some light.
This is the moment families eagerly wait for. Their loved one finally going home after fighting coronavirus in the hospital. But even after leaving, patients like this aren't fully recovered from COVID-19.
It can be that they're symptom-free, but they may still be shedding virus, and so they still need to be isolated. There are people who we don't know what the recovery period is. So recovery can mean many things, and it's not defined clearly.
That's why Dr. Janice Zgibor at USF Public Health says epidemiologists are having a hard time understanding who counts as a coronavirus recovery. While some states report recoveries, Florida does not.
I think it's difficult to record who is recovered because of all of the definitions of recovered. Also, logistically, you would have to follow every positive case to determine when they've met either the time criteria or the symptom criteria.
You may have seen these recovery numbers from Johns Hopkins, but those are actually just estimates based largely on local media reports. The U.S. doesn't have a uniform way of reporting recoveries. That's partly because resources need to stay focused on contact tracing.
Right now, we're trying to prevent or detect people who have been exposed and might become a case, rather than completely following a case.
Because there are asymptomatic people who won't get tested at all, it's hard to even assess how many people have the virus, let alone how many people who were seriously ill got better.
We'll never have really accurate numbers on recovery without that case follow-up.